The setup of the implementation station. The patient at the implementation station is the same patient you will have dealt with at the assessment and planning stations, although time may have passed. For example, if a patient was pre-operative at the assessment station, they may be post-operative now. Prior to commencing the station, you will be provided with a written scenario which explains the date and time of day, and it will also tell you if any procedures such as surgery have been performed on the patient. You should use any reading time to familiarize yourself with the patient's medication administration record. You may need to look up some of the drugs in the BNF once the scenario begins, or if you are unsure of their function. The patient will be represented by a mannequin, but your examiner will also be present in the room to provide the patient's responses. In the spirit of patient-centered care, you should direct your attention towards the mannequin and speak to them directly. This is a 15-minute station, and all medicine should be administered and the documentation completed within this 15 minutes. When your 15 minutes commence, you will need to read the front and inside of the medication administration record before deciding to administer the medication. Depending on whether you are in a hospital environment or a community environment, you may find the following items at the implementation station: a medication administration record, or a MAR chart, a medication trolley with a lock, even if you are in the community, the BNF drug reference book, medications, medicine pots or cups to provide to the patient with the medication in for easy swallowing. If you are in hospital, you may also have IV fluids and a fluid balance chart. All of your actions at this station should comply with the NMC standards for safe medication management and the rights of medicine administration. Prior to your implementation starting, it is advisable to check where the sharps bin is. You may also want to try opening and closing the drug trolley with your key to ensure you have the technique correct.